Turning Point is a national social enterprise. We deliver learning disability, mental health and substance use services across the whole of England. So we have Crisis Point, which has 7 beds, and we provide support 24 hours a day, 7 days a week. The Recovery Lounge is here to support people who are experiencing a mental health crisis and just need a safe space.
People in distress, in crisis, can go without having to go to an A&E department.
They might benefit from just floating about their crisis or working through their problems, trying to come up with a plan, or being signposted to other services that they can access.
It's a space where people can get support quickly without having to go through long waits.
I think our closest relationships are with the mental health liaison team and Greater Manchester Police, because police can just give us a ring if they found someone distressed and they want to bring them to the Recovery Lounge, or if someone's shown up to A&E and they would benefit from the Recovery Lounge, we get a referral from the mental health liaison team in A&E. So I guess those are our most powerful relationships, but we do get referrals from GPs or self-help services and so on and so forth.
We have a team who work across the 3 of our kind of crisis offers, and with it being in the same building as our Crisis Point service, that we are able to be more flexible about where we put the resource at any point in time. From April, we started an A&E pilot where we have a recovery worker based in A&E to support anybody that presents, to help with assessment, to identify people who would be appropriate for our crisis service.
To know that there's staff that are actually out there that do go to A&Es, that are from these kind of places, it makes you feel so much better in actually opening up and explaining how you feel, instead of just bottling it all in and keeping it to yourself, because you feel comfortable.
Our service is possibly at its best when we can have those people know that they can come and use the Recovery Lounge, almost like a safety net.
But the facilities there have been amazing. You can cook here. Any time that you need to speak to any member of staff, there's always a staff on call. It's just nice having somebody there that you can speak to all the time, no matter what you're feeling, without being judged.
We want people to feel at home at Crisis Point. We want them to feel like they are being supported and that they're being looked after. When you're setting up a new service like this, there's not much of a blueprint yet. The whole Crisis Cafe model is still pretty new, and it's quite difficult to describe what staff are going to face, and that's been really interesting. And of course, the potential to grow is only dawning on you as you run it.
Everyone that I speak to has always said, if it weren't for this place, like, they don't know where they would have ended up, because it's amazing the work that they do.
To see someone come through that door and open up to a stranger and then leave feeling like they can keep themselves safe when they get home, I think that's very rewarding.